New modeling from Alberta is suggesting the province has hit the peak of the fourth wave. Health officials say if vaccination rates rise and restrictions stay in place, infections and hospitalizations will continue to decline. Health officials also cautioned they need another week of data to determine the pace at which these hospitalizations will continue to drop. So with all of that information, what is happening in Alberta as our healthcare system is currently being pushed to the brink, and what can be done to help? Medical support from the military, other provinces is now available, but what else can be done? Joining me now for this, Alberta's former Chief Medical Officer of Health, Dr. James Talbot. Good morning to you, Dr. Talbot.
Good morning.
All right, so you had signed your letter previously, signed your name rather, to a letter to say we need the modeling. It needs to be out there to see what Albertans are really dealing with. We are seeing some of that data saying that the province has hit its peak. Do you agree?
I'm cautiously optimistic. There are some problems. First of all, we wanted to see the modeling the province was using, and the model that was actually published yesterday is from an expert group in BC. So that makes us wonder what the government's actually been using to make its decisions. They also said when they did the model that they couldn't use the number of acute cases because they know the testing is lagging, and so that it's a little less than ideal. And as you mentioned, they also said they need at least another week's worth of data to understand whether this is a real trend or not. But I think the good news is that it doesn't look like it's increasing. So that's a positive.
Dr. Talbot, as mentioned in that story previous to you, there are a lot of asterisks here that we're going to see a decline if this, if that. Specifically when it comes to vaccinations, do you feel that the province can get there, or is there a lack of communication? Is there a lack of trust? Where does this all lie?
Well, I think there are a couple of things. The messaging that the government has given in Alberta has been terribly conflicting. Going back to the Premier's statement in July when he threw away all of the precautions that most of Canada still has in place, that this was going to be the best summer ever. He gave the message that basically you didn't have to worry about this anymore. And we said at the time that, it was they were turning their back on a very dangerous virus, and that it was the equivalent of giving the virus an all-you-can-eat buffet. So all of this was completely predictable, and I think people in Alberta are very unhappy with the fact that the government has allowed the fourth wave to happen. And I think a second thing that has made it difficult to get the immunization rates up is that the government has been significantly less aggressive than other places. So for instance, BC, Ontario, and Quebec have all gone with mandatory vaccine passports for essential services, and Alberta it's still voluntary. And so it's being fought, business by business, company by company. And as a consequence, we have the lowest immunization rates in the country.
Dr. Talbot, for you, if you were to be back in the position, Chief Medical Officer of Health for Alberta, what is the first thing you do to help?
The first thing I'd do is I'd send some of the ICU patients to Ontario, where Ontario has graciously agreed to take some of them, because the ICU staff in Alberta are exhausted. They're continuing to do their work every day, but I know from conversations that I have that they're deathly afraid they're going to make mistakes because of how tired they are. So that's the first thing I do, is take some pressure off that system. The second thing I do is make it mandatory for everyone to have had 2 doses of the vaccine to go to non-essential services. That way it would happen all across the province at the same time. The third thing I do is I look at requiring businesses in Alberta to also make sure that their employees either had 2 doses of the vaccine or were working from home. And then the last thing that I'd be looking at is we have the highest rate of COVID transmission in the community in the country, and we need to take some measures to reduce that transmission.
It's a long list. We'll see where any of those get ticked off. Dr. Talbot, I appreciate you taking the time for us today. Indeed, this is something that we need to keep an eye on. Thank you.
Thanks for having me.